Hello, my name is Dr. Theresa Tam, and I would like to welcome you all to this virtual World AIDS Day event. Bonjour, je suis la Dr. Theresa Tam, et j'aimerais vous souhaiter la bienvenue à cet événement virtuel, à l'occasion de la Journée mondiale du SIDA. I would like to acknowledge that Ottawa, where I filmed this video, is located on the unceded territory of the Algonquin Anishinaabe Nation, and I thank the Algonquin people for their stewardship of this land. I would like to thank the Canadian Society for International Health for organizing this virtual event and for inviting me to speak to you. While we cannot be together in person this year, I wanted to take this opportunity to share a few words. This year, World AIDS Day comes at a time when we are facing COVID-19. Both viruses have illustrated how the health, social, and economic impacts have been felt to a greater extent by some, including those living with HIV, and those most at risk of exposure to HIV and other sexually transmitted and bloodborne infections. Cette année, la Journée mondiale du SIDA se déroule dans une période où nous luttons contre la COVID-19. Ces deux virus ont démontré comment les répercussions sanitaires, sociales et économiques se sont fait plus durement sentir par certaines personnes, notamment chez les personnes qui vivent avec le VIH et les personnes qui sont plus susceptibles d'être exposées au VIH et à d'autres infections transmises sexuellement et par le sang. In particular, COVID-19 has impacted the delivery of and access to sexually transmitted and bloodborne infection prevention, testing, and treatment services, including harm reduction services across Canada. The Public Health Agency of Canada is undertaking a national survey of service providers and community members to better understand and address these impacts. The theme of this year's World AIDS Day, Global Solidarity, Shared Responsibility, acknowledges that we all have a part to play to reduce the impact of HIV and AIDS in our communities, and to help ensure that those most in need do not get left behind during these challenging times. Community leaders, researchers, health providers, and peer navigators, such as yourselves, play a critical role in engaging people living with HIV, providing information, challenging stigma, and linking people to testing, treatment, support, and care. I thank you for your leadership, your commitment, and your compassion. Merci pour votre leadership, votre engagement, et votre compassion. Despite the many public health challenges we collectively face, we must not lose sight of how far we have come in our efforts to improve the lives of people living with HIV and to prevent the transmission of the virus. I am encouraged by innovations such as the recently authorized HIV self-test, which represents an important additional tool to improve access to testing in a safe and confidential manner. Today, you have an opportunity to come together, learn from one another, share your stories, and explore solutions to the challenges we face. By working together, I know we can strengthen our efforts and continue to make progress towards eliminating HIV/AIDS as a public health threat by 2030.